Welcome. I am Dr. Sunil Nathamaske, professor in pediatrics and working as a dean in Dr. Vithalrao Vikhe Patil Foundation's Medical College and Hospital, Ahmednagar. On the occasion of Mother's Day, I dedicate this lecture to them only. Today, we are discussing a very simple topic which you come across frequently daily as a medical graduate, and it is really an ornament to all the health qualifying workers. The stethoscope. The stethoscope is an acoustic medical device for auscultation or listening to internal sounds of an animal or a human body. The word stethoscope is from Greek, stethos meaning chest, scopin meaning to explore. Stethoscope is a symbol of healthcare professionals. Healthcare providers are often seen or depicted wearing a stethoscope around the neck. In 2012 research paper, it was claimed that the stethoscope, when compared to other medical equipment, had the highest positive impact on the perceived trustworthiness of the practitioner seen with it. That means, in short, stethoscope is a symbol of a medical person and its attachment and trustworthiness bonding with the patient and his relatives. Once we utter the word stethoscope, the name of the René Thefil Haisnin comes in the mind. Really, this Lannes, he has great inventory in the backbone stethoscope. René Lannes was born on 17 February in 1781. He was a French physician as well as musician. He was working at Necker Infants Maladies Hospital in Paris. The one sentence is true about for every invention, that invention is always a child often need. And this has also happened with the Lannes. Lannes was not comfortable by placing his ear directly onto a woman's chest to listen to her heart. And this history, this problem created the invention of stethoscope. Before the invention of stethoscope, Lannes and other physicians were doing the auscultating the chest in case of pneumonia or cardiac problem, which are shown in the figure, which was slightly embarrassing in case of female patient, also was difficult in case of fat and obese patient, and also in case of children. This was the way to auscultate or hear the heart sound or see the chest problems in the patients. This is the figure how the Lannes was auscultating or hearing the chest problem, cardiac problem, or a respiratory problem before the invention of the stethoscope. This is also same figure where the Lannes is diagnosing the problem of the patient. In 1816, during a cool morning, while walking in the courtyard of the Leard Palace in the Paris, Dr. Lenny Theophile Hyacinthe Lannes observed the two children sending signals to each other using a long piece of solid wood and a pin. With an ear to one end, the child received an amplified sound of the pin scratching the opposite end of the wood. And this scenario has made a great impact on the curious mind of the Lannes. Later in that year, Lannes was called a young woman having the symptoms of the heart. At that time, both the application of his hand to the chest and percussion offered little diagnostic assistance. Lannes was reluctant to start the immediate auscultation, that means by placing the doctor's ear on the patient's chest, since he was the female, because of the age of that patient, sex and plumpiness of that patient. In this moment of embarrassment, Lannes recalled his observation of the children wood-borne signaling. And it was this observation that inspired Lannes' invention of the stethoscope. Lannes spent the next 3 years testing various types of materials to make the tubes, perfecting his design and listening to the chest finding of female patients with pneumonia. After careful experimenting, Lannes decided upon a hollow tube of wood of 3.5 centimeter in diameter and 25 centimeter in long, which was the fortuner or forerunner of the modern stethoscope. His instrument was fitted with a plug when used to listen to the heart, and to make it portable was made in part that could be disassembled. And this divide which he made, he called it as a stethoscope. Stethoscope means chest scope. He called its use to mediate the auscultation because it was the auscultation with a tool intermediate between the patient's body and physician's ear. This was the parts of that stethoscope which Lannes has invented and which is shown in the figure, which has a parts like cylinder, longitudinal section through the stethoscope, longitudinal section without chest piece, lower part of stethoscope and diameter of the stethoscope. This is how Lannes has used this technique to auscultate the patient, to hear the chest problem or a cardiac problem of the chest patient with the help of this old stethoscope. Lannes stethoscope has revolutionized the diagnosis of the diseases of the chest, especially respiratory system and cardiac system. Though his invention is not only limited to this invention of the stethoscope of the respiratory and cardiac diseases, but also he has contributed a lot more in medical practice. His name is eponymously associated with micronodular cirrhosis of the liver. It is known as Lannes cirrhosis. Also, Lannes was the first to lecture on melanoma in 1804. Also, he distinguished two heart sound, attributing the first heart sound to ventricular systole and second heart sound to atrial systole. Lannes wrote the first description of bronchiectasis and cirrhosis and classified the pulmonary conditions. He described murmurs and thrills, bronchial and vesicular breathing, pectoralochi, that is a sign of tubercular cavities, egophony, bronchophony, variety of rales, and normal and abnormal lung sounds. Lannes pulse is a terminology which is referred to the sputum produced by the asthmatic patients. Also, there is a Lannes-Hammond symptom or Lannes-Hammond murmur, which is heard over the precordium due to the spontaneous mediastinal emphysema. This is his medical contribution, and that's why he is known as father of the invention of the stethoscope in medical practice. At the universities, one of 4 medical schools are named after the Lannes. And this is the great contribution of this René Lannes along with the invention of the stethoscope. This is his old seminary with postal stamp. His statue in his place of the birth is still today giving the memory of the invention of the stethoscope. And at last, this Dr. René Théophile Lannes was died due to tuberculosis, unfortunately at the age of 45 years only on 13th of August 1826. After the invention of the stethoscope by Lannes, there are so many modifications are made according to its use, portability, and availability, and practice as per the need and of that moment. After the Lannes, in the stethoscope, the revolution was made by Golding Bird. Golding Bird was born on 9th of December in 1814. He was a British medical doctor and fellow of Royal College of Physicians, and he was more interested in the kidney diseases, and he has also published paper on the urinary deposit. In 1840, Golding Bird described stethoscope he had been using with a flexible tube. He was the first to publish a description of such a stethoscope, but he noted in his paper the prior existence of earlier design, which he thought was the little utility, which he described as the snake ear trumpet. Bird's stethoscope had a single earpiece, which is shown in the slide. Bird's invention is similar to modern stethoscope, except that it has only one earpiece. Bird found the flexible stethoscope convenient as it avoided uncomfortably leaning over the patient, and earpiece could be passed to the other doctors and students to listen. It was particularly useful for Bird with his severe rheumatism, as he could apply the stethoscope to the patient from a seated position. Bird died on 27th of October 1854 at the age of 39 in the city of Setterberg, Kent in England. In slide is stethoscope and His graveyard is shown. Then after Bird and Lannes, the invention and modification was made in the stethoscope by Arthur Leard. He was Irish physician and traveler of the world. He was born in Wexford, Ireland in 1822 and was educated in the Trinity College at Dublin. He was graduated with BA, MB and MD, and in 1851 he invented the first binaural stethoscope. Before this, it was a single oral stethoscope was there, and he invented both earpiece use stethoscope. Arthur Leard died on 16th October 1879. After this, George Philip Caman has made the revolution and modification of the Lannes stethoscope. George Philip Caman was born on September 7 in 1804 in Greenwich Village of the United States in New York. In 1852, George Philip Caman perfected the design of the stethoscope instrument that used both the ears binaural for commercial production, which has become the standard ever since. Caman stethoscope set is shown in the slide, which consists of the tubing, which is covered with a woven cotton sleeve. The tubes are connected to the ivory balls with a threaded pedestal onto which other bells can be attached. The set also includes separate tubes covered with the same cotton sleeve, each bearing a bell at one end. There are two detachable bells were available with this stethoscope. Caman also wrote a major treatise on the diagnosis by auscultation, which he refined binaural stethoscope made possible. Caman died on 14 February 1863 at the age of 58 by making the great revolution in the stethoscope by which is heard used by 2 ears. After him, Somerville Scott Allison made the modification in the stethoscope. He was the Scottish physician and invented a differential stethoscope and wrote a book on physical examination of the chest in pulmonary consumption and its intercurrent diseases in 1860. He described his invention of the stethoscope at the Royal Society in 1858. Somerville Scott Allison, the stethoscope had two separate bells, allowing the user to hear and compare sounds derived from two discrete locations. This was used to do the definite study on binaural hearing and auditory processing that advanced knowledge of sound localization and eventually lead to an understanding of binaural fusion. Two chest piece makes this design different from the standard binaural stethoscope. Sounds from two different areas of the body could be heard simultaneously and compared. It also gave the physician a better chance of pinpointing the source of a sound. He was an expert in both pulmonary tuberculosis and cardiac diseases. However, his instrument was not much of use and therefore not widely used, unfortunately. These are his stethoscopes shown in the figure. Then after the use and modification, Rapport and Sprorage has really made the modern stethoscope, which you see in the market in 1940, which became the standard by which other stethoscopes are measured. It consists of two sides, one of which is used for the respiratory system and other used for cardiovascular system. The Rapport Sprorage model stethoscope was heavy and short. It was near about 41 to 61 centimeter with an antiquated appearance recognizable by their two large independent latex rubber tubes connecting an exposed leaf spring joint pair of opposing F-shaped chrome-plated brass binaural ear tubes with a dual head chest base. This Rapport and Sprorage stethoscope is shown in figure. Then after this, the last and the standard modification of the stethoscope, which is very famous till today, is done by David Littman. Dr. David Littman was born on 28th of July in 1906 in Chelsea, Muscat. He was an American cardiologist in the Harvard Medical School as a professor and researcher. The name Littman is well known in the medical field for the patented Littman stethoscope, reputed for its acoustic performance for auscultation. With Gus Maslov, Dr. David Littman founded Cardiosonics Income to sell his stethoscopes. At that time, the stethoscope line consisted of two key models, the doctor stethoscopes and the nurse's stethoscope. 3M acquired the stethoscope company on 1st April 1967 and hired Dr. Littman as a consultant. 3M currently produces the range of Littman brand stethoscopes. Between 1967 and 70, the Littman range had expanded to 10 models. The tubing color was limited to gray and black, but tubing length was now available in 22 or 28 inches. By the mid of 1970s, 6 major lines featuring a total of 40 models were available. The late 1970s saw the introduction of 3M Littman cardiology stethoscope. 50 of the world's leading cardiologists were asked to design the ultimate stethoscope. The Dream stethoscope featured dual lumen, 2 tubes in one, softer ear tips, and a deeper bell for enhanced low-frequency sounds. In the medical field, Dr. David Littman's name stands for innovation and revolutionizing cardiology. And as its namesake, Littman stethoscope is the gold standard by which other stethoscopes are judged against. The Littman name means superior design and innovation and exceptional acoustic and performance. Dr. David Littman died on 4 January 1981 by keeping his brand Littman stethoscope. In 1999, Richard Desoleris patented the first external noise reducing stethoscope, the DRG Pureton. It features 2 parallel lumen containing 2 steel coils which dissipated infiltrating noise as inaudible heat energy. The steel coil insulation added 0.30 decibel to each stethoscope. The acoustic properties of the specific materials used to make the stethoscope components were first tested to determine their resonance frequency. Some models weighed as little as 133 grams, half the weight of the common cardiology stethoscope from 1960s and 1970. The new models also included a unique set of stethoscope diaphragm, which increased frequency response and could be the sanitary change for each patient. Now, after modification and invention of the stethoscope, we'll see the parts of the binaural stethoscope. First is the binaural ear tips, chest piece, binaural spring, diaphragm, bell, PVC tubing, drum, and non-chill ring. The uses of each part. Chest piece. The chest piece or head of the stethoscope is composed of the connected stem, diaphragm, and or bell. Some models of stethoscope have a one-sided chest piece with a tunable diaphragm. Others have two-sided, double-headed chest piece with a diaphragm on one side and bell on the other side. Most chest pieces work best when applied against the patient's skin. However, some stronger, high-quality stethoscope may be able to pick up the sounds through thin layers of the clothing. The chest piece part of the stethoscope is used to listen the patient's sounds by placing the diaphragm or bell end of the chest piece on the patient's chest, back, or stomach. Second part is the stem. The stem is basically the metal or steel part of the stethoscope that connects the stethoscope tubing to the chest piece. Aside from connecting the two components of the stethoscope, it also allows the user to switch or click between the chest piece's diaphragm and bell by turning the chest piece and clicking it into place via the bell bearing. Rotating the two-sided chest piece on the stem selects or indexes which diaphragm is open to the acoustic path. Then is the diaphragm. The diaphragm is the large circular end of the chest piece, which is very important. Some diaphragm feature a non-chill hypoallergenic diaphragm in order to ensure the maximum comfort for the patient being observed. The larger diaphragm side is normally used for adult patient. Smaller diaphragm bell is best for pediatric or thin patient, for maneuvering around the bandages, or for carotid assessment. This side of device allows medical professionals to listen to a wider area of the patient body and picks up higher frequency sounds than the bell half of the chest piece. Now bell. The bell is the smaller circular end of the chest piece. This side of the device focuses on a narrow range listens for low frequency sounds that may not be easily detected by the diaphragm. As with the diaphragm, the bell may also feature a non-chill hypoallergenic design to provide patient with additional comfort while they are being listened to. Then tubing. The soft flexible line of the stethoscope is known as its tubing. It is relatively short. The next generation tubing provides improved resistance to skin oils and alcohol for a longer tubing life. No natural rubber, latex, or phthalate plasticizers are used in the tubing. Depending on the stethoscope make and model, tubing may be made with single tube or a dual lumen tube desired that connects the metal or steel ear tube. A good stethoscope will usually come with a dual lumen design and tubing that is sectioned off into left and right hemispheres so that the diaphragm or bell sounds can travel from the head of the device to the user's ears with the most accuracy and acuity. Stethoscopes have double lumen tubing, two sound paths inside one outer tube, which helps eliminate the rubbing noise generated by the traditional twin tube stethoscopes. The purpose of the tubing is to maintain and transfer the frequency sounds level that is captured by the diaphragm or a bell and send it to the ear tubes where it can make its part to the user's ears. Headset. The headset is the combined component of upper half of the stethoscope, which include the two ear tubes, tension spring, and ear tips. All of the components are designed together to form a comfortable alignment in the user's ears and are angled in a way that provide maximum sound quality throughout the headset. When viewed from the side of the ear tube of the headset, it can be pointed toward the user's nose while the ear tubes hang back slightly. Headsets allow sound to flow efficiently into the ear canal so that there is a minimal disturbance from the stethoscope. Tension springs. The headset tension is adjusted for individual fit and comfort by pulling the ear tubes apart to reduce the tension or squeezing them together, crossing them over to increase the tension. Ear tubes. The ear tubes are the metal or steel parts of the stethoscope that connect to the ear tips and synthetic or PVC tubing which connect to the stem of the chest piece. The ear tubes are designed to isolate and transfer sounds to the user's ears with minimum quality loss. These metal or steel ear tubes helps to separate sounds into left and right channel in order to provide a better sound experience, which allows the user to more easily diagnose their patient's medical condition. The ear tubes are positioned at an anatomically correct angle for a proper fit into your ear canal. The reef ends of the ear tubes snap the ear tips on the tight for safety. Ear tubes on Littman stethoscope are made up of an aerospace aluminum alloy that provides both strength and lighter weight. The bottom section of the ear tubes connect to the stethoscope tubing line where it receives the incoming sounds. Now ear tips. The ear tips of the stethoscope is the part that goes into the user's ear where they receive the sound that come from the chest piece. The ear tips are generally made out of a rubber or a silicone material and are designed to create a form fitting seal inside of the ear so that unwanted sounds stay outside. A good pair of comfortable ear tips are very important for users who spend a lot of time checking their patient's health with their stethoscopes as it can make all the difference between comfortable experience and an irritating or a painful one. All ear tips are made up with a soft flexible material that is structured to fit and cradle the inner ears. A clear hole in the center so that the sound can easily transfer through them and either ridge or smooth interior on the opposite end of the ear tips where the top end of the stethoscope's ear tubes slide in. Now, this was the part and function of the regular stethoscope. There are some modifications and made in the stethoscope like electronic stethoscope, also known as stetophone. It overcomes the low sound levels by electronically amplifying body sounds. Electronic stethoscope are also used with computer-aided auscultation programs to analyze the recorded heart sounds which are pathological or innocent heart murmurs. Also, there are again, because of this internet era and computerized system, so many modifications are made in the standard stethoscope. Some electronic stethoscope feature direct audio output that can be used with an external recording device such as a laptop or MP3 recorder. The same connection can be used to listen to the previously recorded auscultation through the stethoscope headphones, allowing for more detailed study for general research, as well as evaluation and consultation regarding a particular patient condition and telemedicine or remote diagnosis. There are some smartphone apps that can use the phone as a stethoscope. In slide, you have seen there are so many modifications are made in the stethoscope. There may be computer, mobile operated, or Bluetooth operated or wireless stethoscope are shown in the slide. At least one uses the phone's own microphone to amplify the sound, produces a visualization and email the result. These apps may be used for training purposes or as a novelties, but have not yet gained acceptance for professional medical use. The first stethoscope that could work with a smartphone application was introduced in 2015. These are also other modifications made in the regular stethoscope as per the computerized mechanism. Now, slight variation from the regular stethoscope. Fetal stethoscope, commonly known as fetoscope, it is an acoustic stethoscope shaped like a listening trumpet. It is placed against the abdomen of a pregnant woman to listen to the sounds of the fetus. The fetal stethoscope is also known as Pinard horn after French obstetrician Adolphe Pinard, who invented this Pinard horn. Now, Doppler stethoscope. A Doppler stethoscope is an electronic device that measures the Doppler effect of ultrasound waves reflected from organs within the body. Motion is detected by the change in frequency due to the Doppler effect of the reflected waves. Hence, the Doppler stethoscope is particularly suited to deal with moving objects such as beating heart. Now, 3D printed stethoscope. Here, the pioneer is Canadian doctor and humanitarian Tarek Lobini, who developed low-cost stethoscope in 2015. 3D printed stethoscope is an open source medical device meant for auscultation and manufactured via means of 3D printing. It was developed, just as told, by Dr. Tarek Lobini and a team of medical and technology specialists. 3D stethoscope was developed as a part of GILA projects and its design is open source for the outset. In 1960 era, Littman cardiology 3 stethoscope became the basis for the 3D printed stethoscope developed by Lobani. This was about the stethoscope types, its part and inventories. Now, in many of the medical schools or medical colleges, like a white apron ceremony, along with that or separately, stethoscope awarding ceremony is also conducted after completing the graduation. Also, this is the honoring event for the medical graduate to be part and parcel of this stethoscope ceremony. As initially we have discussed about the role of the stethoscope in the medical diagnosis, according to that, this is only one instrument which cannot be purchased by money. To get this instrument, that is a stethoscope, we have to qualify in the medical school or medical college or health professional institute for certain period of a time, and then only you are honored with this stethoscope. This is only the noble instrument which can be awarded to you after qualifying or graduation of the medical school. This stethoscope is a symbol of medical profession. It is honored with respect and should be kept in a proper place during off hours and during on hours of the practice. In conclusion, in short, stethoscope plays a wide role in medical field. It helps in diagnosis of heart diseases by detecting abnormal versus in heartbeat. It detects the presence of pneumonia and many fluid blocks in lungs and the heart. Thus, invention of stethoscope had really helped the doctors to cure the many diseases. So, for stethoscope, the journey has started from the Dr. Rene Theophile Hyacinthe Lannes, who invented and pioneered the importance of the stethoscope. After that, various modifications were made according to the need and course of the diseases. And till today, this stethoscope is a brand and noble ornament of every medical persons. Thank you.